Some gifted students are being prescribed medicine for disorders, but that disorder is in fact giftedness. Two fates that often befall gifted students is receiving a misdiagnosis, like crying wolf when there's none at the door, or getting no necessary diagnosis, not seeing the wolf huffing and puffing at the door. Let's first look at misdiagnosed gifted students. Many gifted students get diagnosed with deficit-based diagnoses such as ADHD or ODD or OCD that end with the word disorder, but don't require medication and that don't require a disorder label, says clinical psychologist Mark Kluko. But how is it possible that giftedness can look like a disorder? In reality, certain gifted traits are often mistaken for learning disabilities or behavioral problems. A gifted brain thinking fast often translates to a body and a mouth that's always moving and may be misdiagnosed with impulsive or compulsive behavior, such as attention deficit, hyperactivity, or obsessive-compulsive disorder. A gifted child who sees, smells, tastes, and receives more intense stimuli than others may appear to have sensory processing disorder, or SPD. Giftedness and Asperger's share an ability to have hyperfocus and pursuit of passions and a tendency to find social interactions difficult. Anxiety, worry, and highly emotional reactions aren't uncommon in gifted kids. An incomplete assessment might diagnose anything from bipolar disorder to major depression to generalized anxiety disorder. A gifted child is capable of extraordinary imagination and creativity. If observed at school, such a gift might look like distractibility or a lack of focus typical of ADHD. Just because behavior is present doesn't mean that behavior is debilitating. We must always push professionals to identify whether the behavior is actually preventing healthy functioning in social settings, school, and work. For example, hyperactivity itself is not enough to diagnose ADHD. Only when it significantly interferes with the individual's ability to learn, demonstrate knowledge, or interact with others is the diagnosis appropriate. Some gifted kids look distracted, but when a teacher asks that child to explain what they were being taught, the child is perfectly capable of doing so. The chances are that your temptation will be to push for treatment of symptoms and alleviation of discomfort for the student and for your class, even when those symptoms don't prevent healthy learning in the gifted student. A risk exists that treating those symptoms with medication alone might actually discourage a child's development and prevent creativity and original thought. Think about the difference between focus and distractibility. Focus is what makes students sit still and work quietly and stay free from distraction and daydreaming. It's what most teachers want to see. But research shows that there is an inverse relationship between that kind of focus and creativity. The more focus you have, the less creative you're able to be. Completely getting rid of distractibility puts out the flame of creativity. Gifted traits often misdiagnosed. High activity, impulsivity, worrying, sensitivity to loud sounds, sensitivity to textures, heightened emotions, refusal to do schoolwork, failure to complete tasks, stubbornness, difficulty with transitions, impatience, tendency to interrupt, argumentativeness, frequent mood swings, distractibility, reading difficulties, poor handwriting, not paying attention, poor sleeping, poor eating, and atypical humor. I included these in a resource for you. Perhaps my biggest concern with misdiagnoses is the message a child receives when we treat what is innate in their wiring as malfunction. We want to avoid saying, "You are too much and you must get rid of your intensity. Your natural traits are unacceptable and need fixing. We like your gift and you're intelligent, but need to squish those intensities that come with it." When this is our message, guilt and shame results and no one wins. Instead, we want to communicate, your intensity is part of who you are. It's the flip side challenge of your amazing gift. Your brain is different, and I get that it's hard for you. That doesn't mean there's something wrong with you. Because you think and feel more intensely, you will sometimes experience more discomfort than others, but you have the ability to get better at managing it. When this is our message, children get to know their strengths and their weaknesses. True education is developing both the gifts and addressing the challenges to help all children grow and thrive. But this isn't just about medication. And your role as teacher is not to diagnose anyway. The good news is that the more holistic responses and support that gifted students need overlap with what twice exceptional students need, and working towards giving such support has no downfalls. Gifted kids have special emotional, social, and behavioral support needs. Anxiety, even when it doesn't qualify as a disorder, still needs support. Severe sensory discomfort cannot be ignored. Our children need empathy from us and practical help from mental health providers. I like Stephen Covey's principle, begin with the end in mind. When I talk to my daughter about doing the hard work of learning to manage and challenge anxiety, we remember that the sooner she can learn how her mind and her emotions work, the better. The stakes will only get higher as she gets older. My intention is to find her the support she needs and not just to say no to medication. A holistic response involving therapy like cognitive behavioral therapy or CBT is a slower road but offers greater rewards in the long run.